This is about how COVID-19 is impacting us all. That's a 1-month-old infant baby boy who has been detected with COVID-19, with the coronavirus. Of course, in the arms of the nurse supervising this baby's recovery. As per the doctors at the Moolchand Hospital, where this baby boy was undergoing treatment, the baby was brought with increased irritability, fever, was not accepting milk feed, and that is when the parents of the child rushed him to the doctors. On examination, COVID was detected, treatment was provided, and the good news is that the baby has been discharged. He's back with his parents in 4 days' time that he was there at the NICU at Moolchand Hospital in Delhi. But why we are showing this to you is a reminder that children as young as 1 month old are being infected in the corona pandemic, even with the Omicron wave. And the one who was supervising this child is Dr. Preeti Chadha. She's a consultant pediatrician and is also with the neonatal department at the Moolchand Hospital in Delhi. Dr. Preeti Chadha, thank you for speaking to me about this very important and crucial story. My first question will be, because this is a 1-month-old baby boy infected, were there specific symptoms? How did the doctor suspect that this could be a case of COVID-19? Do tell us about this case that came to you.
See, this was the 1-month-old baby which delivered under my care only. I was seeing this baby since baby was a newborn. I was doing the follow-up. Before few days, the parents called me that baby is very irritable, he's crying very much. So I called them for a checkup. That time baby was fine, but after 2 days, again father complained he is not taking feed, better to see the baby again. That time I found baby was having running fever and baby was very irritable and he is having ear discharge. That's why we suggested to admit the baby for antibiotic for the ear discharge, because he was very irritable and not looking in a quite good state of health. As an admission policy, we did the rapid antigen test, which came positive. That's why that was a incidental finding along with the ear infection.
Okay.
So we were planning to admit the baby for the ear infection, and the COVID. He was tested for the COVID also.
So doctor, if you can confirm to me, for how many days was this infant baby boy in the Moolchand Hospital in Delhi?
Yeah, baby was admitted in Moolchand COVID isolated NICU, because just 1-month-old baby, so we kept baby in an NICU. So baby was with us for 4 days. We gave IV antibiotic. Baby responded to antibiotics. His ear discharge, his pain, fever was decreased, and baby remained stable in the nursery. We did a close monitoring like oxygen level and all this, but baby remained stable. So we planned discharge after 4th day, after the coverage completion of 4th day of antibiotic. With baby was without fever for 3 days and was taking feed properly. Then we planned for a discharge to the baby. So baby was with us for 4 days.
Well, there's a positive news of a kind that we would like, that the baby is discharged and back home. But the doctor, has there been a rise in infant or toddler cases or hospitalization that the doctors of pediatric age group are witnessing in this wave? And please do tell us then, what do young parents, what do they need to know regarding children with COVID that is also spreading around us?
See, we have seen infection in a pediatric, like babies or toddlers, in last wave also.
Yes.
Yes, of course. In this way, we are seeing more number of cases as the infection rate is high. That's why we are seeing more number of cases in pediatrics also. So, and my advice for the parents is that just no need to panic and just observe their baby. If they feel there is if baby is taking feed properly, doing urine properly, and is baby is active, no need to worry, no need to do panic at all. We have seen the newborn babies, like 15-20 days old babies also with positive infection.
Okay.
But they all are managed at home.
Okay.
No need of hospitalization or anything.
All right. So not very severe cases, but there are cases being reported and being hospitalized. Now, I'm also a young parent, Dr. Preeti. I also have an infant baby at home, so I can also connect with the concern and fear of many today. Do you think that it is also important for parents to know that we do not let our guard down, thinking it's a mild variant, it's not leading to a lot of hospitalization? Do you again give that recommendation that we do not let our guard down around children even now? Because specifically this age group is unvaccinated even now.
Yes, children are not vaccinated and their immunity is also very underdeveloped.
Yes.
So we need to be very careful along with these children. Parents, if they are going outside, so let's keep their guards up only. The masking and social distancing is must. This precaution which we are following in COVID. This is the universal precaution which
Yes.
we take care for the babies. That is pre-pandemic era also we were using the same precaution for the babies. So that is the only advice. No overcrowding, no exposure in a crowd. You please put up their guards and do the maintain social distancing.
Dr. Preeti Chadha, thank you so much for your advice and for taking care of these little babies and ensuring they recover well and head back to their home with their parents. Thank you so much for the work that our healthcare workers have been doing for now more than 2 years. That was Dr. Preeti, 1-month-old baby who has been infected with COVID-19. There were symptoms as well, but is now, of course, headed back home.